in July of 2013, if you were an uninsured patient that called Denver Health to get an appointment, we put you on a waiting list, and it took roughly 6 months before we could appoint you. 10,000 people were on that waiting list, comprised of all payers, people with insurance, Medicaid, Medicare, commercial insurance. 10,000 people. We began applying some lean concepts to access. We said, this is not what we're about, this is not who we are. We took a 10,000 person waiting list down to 0, and we did it in a year in which we were getting thousands and thousands of additional patients trying to access our system through the Affordable Care Act. We could not have done that without lean principles, lean concepts, thinking about our entire organization as a system, identifying where those pain points were, and aggressively putting effort around eliminating those for the benefit of our patients.
Lean puts you to a discipline of thinking, and often the solutions are not complex, but the thought process of getting there and putting a pause on the whirlwind and focusing on the improvement and using specific tools and ideas and a mindset for approaching this is what gives you some very powerful results that instead of getting a 2%, 3% improvement, oftentimes you find things you weren't looking for and you'll get an 8, 10, 20% improvement instead.
So there's very much an embedded respect for people, and it dovetails nicely with the leadership culture here, which is we won't come tell you what to do. We'll partner with you, we'll remove barriers, but as a leader in this organization, you're expected to critically think about your area and what it is that's driving your performance. Now, at its heart, lean has respect for people. Why would I put you in a process that's inefficient? Or why would I require you to do work that's just wasteful? So, at its core, lean is trying to be respectful of people.
When people begin to realize there's something different going on here that maybe you don't see at other places, and there's a method that has respect for people, respect for the providers of the care, respect for the patients and the families, interested in quality and safety, growth, and all of these other things, but it's part of a larger philosophy, a larger way of thinking and doing, and I think people value that.
So the framework, in terms of a process improvement framework, gives you a way to think about it. It brings certain tools, it brings certain discipline into the process, and lean does that. 6,000 people showing up every day, having a clear understanding of how they align to strategy, and knowing what my metric for today is that will indicate whether or not I'm successful in achieving strategy.
You have to believe deeply that it does work and it's going to make the improvement that you want to make. Resist the temptation to think that this is just another fad or just another thing. It's actually based on strong theory and evidence over a 65-year period of time.
This is how we do work. It's how we think about improvement. It's how we think about process at Denver Health.